All right, so we'll go ahead and get started. Um, Hi, everybody. My name is Kenzie Dean, um, and I'm the clerkship coordinator for family medicine. So, in your third year, when you guys are on your clerkships, whenever you guys reach family medicine, I'll be the person that you guys will kind of be in touch with. So, today, the purpose of the meeting is just for you guys to hear from all of our regional sites and then um, go into the ranking. You guys can get an understanding of that. We'll talk about extenuating circumstances, and then I'll kind of get you guys on board with the timeline once we conclude to see kind of when you guys will hear back about your placement. All right, so let's go ahead and begin. So, like I was saying, your third year, family medicine is a required rotation. It will be 4 weeks. It's going to be pretty much mostly outpatient. We do have some sites that will offer some inpatient on certain days. And then we've recently added CrossFit, so that's really exciting for you guys to be able to hear from. But we used to have eight, now we have nine. So you guys will get a chance to hear from all of them. So, a little bit more about the survey and the site selection process and how that works. It is a lottery system, but we still want you to rank based on preference where you would like to go the most. And so, Jessica, are you on? I know she had to step away for a second. Okay, so after the meeting, I'll go ahead and put into the chat an actual link to the survey for you guys to go ahead and start filling those out. It'll be open for about 2 weeks. So about January 30th is whenever we'll start the lottery process and get you guys placed. So I would say that first week of February is when you guys will hear. Now, if you are a rural practice student, you will not rotate in Little Rock. Um, we try to get you guys out there at our regional sites. And then if you do have any extenuating circumstances, say if you have children, if you're a caregiver, or if you have any disabilities or any transportation, um, concerns, then you'll just put that in the box on the survey. And there's a specific part of the survey that'll ask for that. So, we'll ask you for your name and then your block, which I'm sure you guys all should have those now with the dates that you will be on the rotation. So we'll have that. And then we'll ask you whether or not you need housing for each site. So you will have to let us know whether or not you need housing for every site because it is a lottery system. So you may or may not get your first or second preference. But the good news is that our housing is free. So, um, and I'll talk more about that on the next slide too. But yeah, so we'll let you know probably looking at sometime in February when you have that placement. All right, so like I said, housing is free at every site. Um, you will have a chance to let us know in the survey whether or not you need housing for that particular site. You may or may not share an apartment with someone. I know our coordinators really do our best to try to get you your own space. But on those rotations where we do have multiple students, you may be sharing a rotation. I mean, maybe sharing a common space with another student. So please just be courteous and mindful about that. Pets are not allowed in our apartments and families as well. And then housing details, our coordinators are really good at reaching out to you guys as far as checking in about 1 to 2 weeks before you actually begin. So we'll make sure that you guys are all set as far as getting onboarded and getting to your sites before we begin. Okay, so this is a typo. We have nine now. We'll talk about Little Rock, and then we'll get a chance to hear from our folks at Baptist. We'll start with Batesville. We'll hear from Jonesboro. We've got Northwest. We've got Palm Bluff on, Texarkana, Fort Smith, and our new site, we've got Crosses. So that's really cool. We'll get a chance to hear from everybody. Um, Whenever we hear from everyone, I'll probably have the coordinators introduce themselves and then site directors if they're on. And then you guys will get a chance to hear from an M3 that currently was on the rotation this year. So you guys can kind of hear from their perspective about their experience at that site. So really cool. Also, if you guys have any questions, just go ahead and shoot me an email about the site selection process at any point. I'm pretty good about getting back, or if you have a question and I don't know the answer, I know who to reach out to. So, um, guys are free to send me an email and I'll make sure that we get those questions answered. All right, so if you rotate in Little Rock, go figure, I will be your site coordinator. So I try to get you guys seen with some procedure clinics. We're mostly going to be outpatient. We had a little bit of talk of putting some inpatient in there, but expect to be mainly outpatient. You will have some experience working at the 12th Street Clinic, probably about once or twice, and I believe you all have volunteered there already, so that's a plus. Um, and then we have our site at Capitol Mall that I will send you guys to work with a couple of our docs over there. Dr. Chirla, are you on by chance? All right. Well, Mackenzie Henderson, she was our M3 that rotated with us earlier this year. Mackenzie, do you want to talk about your experience a little bit?
Yes. So as Mackenzie said, my name is Mackenzie Henderson. I'm an M3. So far the rotations that I've been on have been my selectives. I did in ortho and PM/NR. Then I did family medicine in Little Rock, neuro, psychiatry, OB/GYN, and right now I'm on my peds rotation. So some of the things that I really enjoyed about the Little Rock site was that I had a chance to see a variety of things. So for one, we were in the outpatient clinic, but in the outpatient clinic, you get a chance to do procedure clinic as well. And so I did a few procedure clinics with Dr. Go, got a chance to see like skin biopsies done, cyst drainage and things of that nature. One patient had like, a trigger finger, and so seeing how the steps to like help that patient was really cool. Another thing I enjoyed was that you get a chance to spend time with like the different people involved in a person's like total care. So I had a chance to spend half a day with the dietitian. She went over a lot of neat um, food plans and things that they have for diabetic patients or patients looking to lose weight. You get a chance to spend time with the pharmacist and the behavioral health specialist, which I thought was nice. Because at that clinic, you kind of see a lot of patients who may not have a lot of available resources that they need. Um, and so seeing and maybe experiencing outside stressors from other like units. So spending time with the behavioral health specialist who she was a trauma therapist for a while in her career and hearing how she helped her patients and seeing the interaction was cool too. And then I also enjoyed the off-sites, like at the Capitol Mall Clinic, downtown. It was fun working with those providers. And also doing 12th Street was fun as well. And then in my clinic schedule, there were half days built in throughout. So I got a chance to study before going to clinic or going to clinic half a day and then studying the rest, which was really helpful. Um, I enjoyed the experience. If I could do it over again, I would. And everyone was nice. And even like, and they care about you learning. The residents do as well. They're really good about teaching you different concepts.
Yay! I'm glad that you had a good experience, Mackenzie. That's really good to hear. Um, so next, let's hear from our folks at Baptist. We've got Dr. Burks on, and then we've got a student, Claire, who's going to share her experience there. But let's go ahead and start off with Dr. Burks.
Guys, I'm here with our medical director of our clinic too, Dr. Shandoval. Hello. Who we just thought it might be fun to both do this thing. Um, we love having the medical students with us. I know everybody loves having the medical students with us, but we really do. Some of the benefits that aren't listed on the slide are, of course, we're close to home, but we're in a community hospital outpatient setting too. We've got, as she put on the slide, we've got free lunches every day. It's kind of buffet style, but it's really good food. Chicken wings, lasagna, beef tips, stir fry, fresh fruit, steamed veggies. I mean, it's like good. And then we've got about 30 restaurants within 2 or 3 miles and a whole bunch that are within a mile. We've got a rural clinic site that we're associated with that's 20 minutes due east of us, that the students can spend zero time or up to like 7 days out at Lone Oak if they want to go there too. And they're more procedure oriented out there. So we can change the schedule as we want to. We're pretty flexible with spending time out there. We've got a really diverse patient diagnosis. That was said wrong. Our patients have diverse diagnoses, and most of our students have been able to complete their checklist within the first 2 days of the rotation. So there's not much stress with completing the checklist. We have structured feedback sessions twice a month. We're all supposed to do that, but we really, really do focus on that. So the students have an idea how they're performing and feedback about future rotations, some personality feedback, and not personality, but interviewing style feedback, and especially feedback on the notes. We ask for usually 2 notes per day when the resident is ready to start, or when the student is ready to start writing notes. And we're like all the sites are, we're a really supportive and comfortable atmosphere. We laugh and love appropriate humor. And if the student is comfortable and capable, we encourage almost an AI-like atmosphere in our clinic. And the residents really like to teach and we've most of the time the students spend with residents, not faculty, because we don't have much faculty clinic at this point. So that's all I've got to say.
Thank you. Okay, Claire, you ready?
Yes. Hey guys, my name is Claire. I'm currently in M3. I rotated at North Little Rock back, I think in September. It's been a second, but I absolutely loved my time there. It is like still one of my favorite rotations by far. It's super nice. You get to stay where you're living currently, which I think is huge, but you also get to like see a different hospital system and how they do things a little bit differently than we do, which was really nice. Every single person at Baptist is so kind, so supportive, so helpful. Like Dr. Burks was saying, you get to work a ton with the residents, and they all are such great teachers. They really take you under their wing, and you get to work with a ton of different residents also. Like I think in my time there, I was working with like 10 to 15 different residents, and you kind of get to see their different styles and take what you like from each of them, and it helps you become a better interviewer for sure. I also think I was one of, if not the first student that got to go down to the Lone Oak Clinic, which was really cool to see a different kind of atmosphere, more of like the rural medicine clinic, and really loved my time there as well. You do get free lunch every day that you're there, which is a nice little perk to have. There's also just like great little spaces to study. So I would like grab lunch and then go study for an hour, or come in early some days and study before I had afternoon clinic. Um, Trying to think what else. It's just like a really great supportive environment. I had the best time. I want to go back, honestly.
Awesome. That is excellent. All right. Next, Batesville.
Hi, I'm Kim. I am the student coordinator here at Batesville. I'm not sure Dr. Royer is on. She's the site director.
We're over here.
Um,
We're here.
are you there? Okay, you talk.
No, Kim is actually the person that medical students spend a lot of time getting to know. She's the one who sets up the apartment, make sure it's clean, make sure the rules are followed, make sure your keys work. Also helps get you in if your badge doesn't get you in. So those are all very important things. So we appreciate Kim, and this is a huge part of what she does. So thank you. I'm Dr. Rillier. This is Audra Staley. She's our third year chief. Also was a medical student at UAMS, also rotated here as a third year and a fourth year. So I was wondering, like, what do we have that we say, oh, well, my favorite restaurant isn't even on there. So
Poke and paddle.
I like Poke and Paddle,
Yeah.
which is new and part of the revitalizing downtown area. Batesville's a town of 11,000 people, so you get your rural practice. But the Main Street has really been pretty fun. And I've lived here for 25 years. I'm practiced with UAMS for 7, and been the site director for about 6 of those years. So really, we do enjoy our residents and students. Sorry about that. It's also one of the best ways we can recruit people to come and look at us, because it's really hard to explain Batesville kind of in words. So, but I was going to let, and also we have Dr. Sullins on, because I was worried that we'd have no faculty available, because we're going to try and run to go learn about pap smears at Grand Rounds. But Audra can answer any questions or add some more. What do you think Batesville got to offer?
Yeah, I mean, I don't think Batesville was on my radar, and it feels like it was not that long ago that I was sitting in all of the M3's positions where they're at now. And I was like, yeah, it's like up north. I don't really know much about it. And I ended up coming here for my family medicine rotation because I really liked the vibe in this setting. And just fell in love with the people here, fell in love with how much they care about their patients here and how dynamic family medicine is practiced here. You know, I've loved being able to be a clinic doctor here. I've super loved being able to be an inpatient doctor and an ER doctor. I think those are 3 areas that our program really thrives and really sends a lot of our graduates in those directions. I know I'm staying on to be a hospitalist here in town afterwards. So super excited about that. But it is, like Dr. Roulier was saying, it's a place that you don't fully understand and can't fully appreciate until you come and see us. But I promise you that you will, if you come here, you will not leave without Dr. Roulier, and probably more than that, somebody making you some kind of baked good. So it's at least worth it to come up here for the cookies.
No, we take that to Donna Chewy also usually.
Yeah.
So we only have lunch 1 day a week. I'm really sorry, but you have a great apartment.
Yeah.
And Aldi's. So I think that Dr. Sullins may be on. Do you have anything else to add?
I think Audra did a great job. I think that we have a really positive environment. We have a good time. You get to see a lot of neat stuff that you might not expect. Batesville's a very small town, but the population I think practically doubles during the daytime because of the area that we draw from. And so we get a lot of pathology due to that. And so it's great. We have Dr. V comes, once every couple weeks, and so that's cardiology that we have worked into here as well. That is beneficial to us and brings even more through the doors. So it's a fun time. I really enjoy it. I think Audra probably said everything that I could say to it.
Awesome. Okay, Abby, you ready?
Hey, Abby.
Yes. I'm Abby. I am a current M4, but I actually did my M3 rotation in Batesville and then also went back and did an AI in Batesville. basically chose family medicine because of them. All of them know this. I love them very much. Some of my favorite people. So basically the way Batesville works for third year, it was a long time ago. Bear with me, but it's about 4.5 days of clinic a week. You can do like some time in the ER if you want. They can try to get you an inpatient day if you want. A lot of independence. You get to do a little bit of work with the pharmacist. You get to do some work with the behavioral health specialist. So that's really awesome. One of my favorite things is that there's a very large Hispanic population in Batesville. And so I think there's only one resident now who speaks Spanish, but you can do like a Spanish speaking clinic. So I got to do that while I was there with one of the Spanish speaking residents, and that was really great. But yeah, super quaint little town, but it's really fun. Everyone is so welcoming. The attendings are great. All the other faculty is great. The residents will be some of your best friends by the end of it. I cannot count the amount of times I went to Audra's house. So we've done many things. I've been in Dr. Rollier's house. I've met her for coffee. I've gone to her yoga classes. So they just kind of treat you like family, and it's a really amazing rotation. So might be somewhere most people are not familiar with. I know I wasn't, but it was the perfect place to wind up. So it's really fun.
Awesome. Okay, now let's hear from Jonesboro.
Hey, my name is Michelle or Stephanie. I go by either one. So I am the coordinator here in Jonesboro. I'm not sure if Dr. Chu is on with us. Dr. Chu is our site director. And then I have a couple of students that I think are on here. And so what I'll do is I'll just go through here and tell you a little bit about the apartments and some things about the clinic, and then I'll just turn it over to them. So our apartments, they're newer apartments, and they're 2 bedroom, 3 bath, and if at all possible, you will have your own apartment. They do have a garage, and they are in walking distance from both the clinic and the hospital. And you will be working at the hospital a couple of days during your rotation, and you will have free meals. And so at the hospital, we have like a little cafe that you can go to get coffees and different things. And then we have also each day of the week, there's a different specialty bar that's in the hospital that you're welcome to as well. Like we've got chicken salad chick, we've got Schlotzsky's, and I really can't remember anything else right now. And then our clinic, we have 24 residents, and they're split up into 4 different pods. We do have an on-site pharmacist and a behavioral health specialist that you will be spending time with. And then we do our procedures on Thursdays. A few of them, we do circs, we do injections, IUDs, and then we set aside Friday as your scheduled study day. And that way you can, if you need to travel, you have that as well. Jonesboro is a very hands-on and laid-back clinic. So I would say don't be afraid to jump in. And then I guess that's going to be all I'm going to say. I'm going to turn it over. We've got Grayson and we've got Corey on.
I can go ahead and start. So Miss Goss, you kind of stole some of my talking points over there, but the food in the cafeteria, it is really good. The first day I got there, I went to the store. I was like ready to prep my meals. I was dreading it because I don't like making my own food. I make my husband do it when I'm home. But then I showed up the first day and she said, "Okay, so here's the calf. Go for it." And so I never ended up eating that food. I just took it home for my husband. But other than that, the people there are so kind. friendly, respectful. Sometimes it feels like as a student that you're definitely not an equal and it's pretty obvious, but it seems like family. They try to make you feel included in everything. Even like the nurses, the pharmacists, everybody includes you in their conversations. They ask your opinions and they'll have that conversation with you. And it doesn't feel at all like judgmental ever. Um, the presentations are not scary. Everybody is just so accepting. And then if you say that you're interested in procedures, this is something I did with one of the attendings. He would come get me when it was time for a procedure, and I got to do some steroid injections. I got to do skin tag removal. So they want to help you and they want you to have as much fun and get as much out of it as possible. They're very flexible. If you say, "Hey, we have the shelf coming up and I'm terrified," they make every second count for teaching, or like you can say, "Oh, I have no idea. Please tell me about the guidelines here." And they'll bring it up over and over so you kind of can keep getting that repetition. And it's not necessarily in like a quiz kind of way. It's more of a discussion always, so that it's not very intimidating. It's more just like a fun group study session almost. Like they want to learn, study it with you. Um, like she said, we got to discuss a lot with the pharmacist and the behavioral health specialist there. And that was really nice because we would know exactly who we're sending our patients to and chat with our patients about who exactly they were going to see and all of those fun things. Miss Goss is like an angel on earth. She made life so much easier than I was expecting it to be. First day I showed up, my sink wasn't turning on. It turns out it needed batteries, but it was like 9 o'clock at night, and we both discovered together that some sinks need batteries. So that was just an interesting fact. But she's just always there. It kind of felt like if I had a flat tire, I could have called her and it would have been fine. Um, but just other than that, the best part, other than having Friday off, being able to go home and study, because it is a little bit further of a drive than some of the other locations, was the housing and the walk. You could walk home for lunch if you only have like 20 minutes to eat. You could just like have a moment, because sometimes I need a moment, and that was perfect. Um, but it's just so great. 10 out of 10 would recommend. I was terrified. I remember hearing the talk from the M3 our year about going to Jonesboro and thinking, oh, that's great. And I signed up for it and I got it. And I was like, shoot, it's 2.5 hours away. Why did I do that? And it was great. And I'm glad I did. But don't let that scare you. It's a nice time.
Thank you for your kind words, Corey. I appreciate that. And yeah, you can call me.
Hi, I'm Grayson. I'm the other student that went to Jonesboro. I was in Jonesboro kind of end of October and mo or end of September and most of October. Corey pretty much covered a lot of the good stuff about Jonesboro. The houses are really nice. You can walk to clinic, which was really nice, especially if you run chronically late. You actually are never late. Um, Not having the meal prep is fabulous. Something that I did a little bit different than Corey is I didn't come back to Little Rock on the weekends. I kind of explored Jonesboro. And so not only do you get a great clinic with great residents because they are so nice and so inclusive, you also get a pretty cool town. And you can kind of just experience what Jonesboro also has to offer, which was fun. I did go and walk out at Craighead Forest Park a couple times. So um, they're not only offering a great place to learn because the clinic and the residents are fabulous, but they're also kind of offering a great place to just kind of exist for 4 weeks, which was also really fun, especially because we had Friday afternoons off and you just kind of got that time to explore a little bit, especially if you've never been there. The faculty and staff are amazing. The residents include you, and they do some fun stuff that they also ask you to go through. So, me and the other student that was there, played Jeopardy with them, which was really fun. They play Family Feud on occasions for their like lunch activities. So, Um, Overall, it's a great time. I'm with Corey, 10 out of 10. It's a great place. It should be on your radar for sure.
Awesome. Okay. Springdale up in Northwest.
Hi, everyone. I'm Teresa. I'm the student coordinator. Dr. George had clinic today, so I'm not sure if he is available. I've only been in this position since March of last year, so I'm still learning ins and outs about it as well. But we have 3 apartments. You will get your own apartment because each apartment is 1 bedroom. It is walkable to our Fayetteville site, but we are a unique situation where we have a Springdale site and a Fayetteville site, and you are scheduled at both sites. So you will need transportation for Springdale. We also have Marshall Lee's North Street Clinic that you will be in every Thursday afternoon. And we do have 1 faculty member who is Spanish speaking. And so if that is something that you would like to practice, you can let me know. And I will do my best to make sure that you are with her. And I think we have Jared on who can talk a little more about it.
Yeah, hey everyone. I'm Jared. I'm an M4 and just helping out with the family medicine site presentation. And I did my family medicine rotation at Northwest. And it was a great there were so many learning opportunities there. You really get a lot of autonomy with taking patient history, going in first before the residents, and getting to present the patient like to the attending that's on staff. And all of the residents are super nice. I think it was super cool that there were like 2 locations you got to go to, both in Fayetteville and Springdale. They were like really unique in that you got to see just a really wide diversity of patients, like lots of Spanish speaking patients, and like what Miss Teresa was saying, like lots of Marshallese patients who have their own like unique health issues. And so that was just a really good opportunity. And then it's great because like when you're at the Northwest campus, you also get to work alongside some of the UAMS Northwest campus students, which is fun and nice because you don't really get to see them like if you're from Little Rock. And then and then there's like built-in half days for studying. And if you ever need a day off or something like that for something personal, Miss Teresa is great. She really helped us out when we were all up there. And she's so nice. And if you ever need anything, she's always there. And yeah, and then just Northwest Arkansas has a lot to offer. Lots of great food and activities like on the weekends for you guys to explore.
Perfect.
Kenzie,
Okay.
sorry, can I say something else about Northwest?
Yeah,
The
yeah.
apartments are walkable to downtown Fayetteville as well. So, and there's lots to do down there.
All right. Jalecia, you ready?
Yes, I have 2 students on, Andrea and Sarah. But first I'm going to let Dr. Diaz introduce himself and then I'll talk after him.
Hello, my name is Cal Diaz. I'm the site director in Turkana. Um, I think we're in a pretty unique situation as well. We serve the people from 4 states: Louisiana, Oklahoma, Arkansas, and Texas. That's interestingly there's differences with insurance. You'd be surprised. Um, but um, but I think our clinic is well-rounded. Um, so you will get a lot of experience in a wide variety of pathology. We also have a lot of procedures. We do skin, orthopedic sports procedures, and gynecologic procedures like skin biopsies, joint injections, colposcopies. We have a dedicated obstetric clinic because we got a new faculty from Magnolia who does OB. So he's running an OB clinic here. That's something that you'd be interested on. That's good. And we have a dedicated pediatrician in the clinic, board certified pediatrician. So we have a peds clinic. So I think we have a pretty wide range of cover a wide range of interests. Our residents are we're very laid back. We're very laid back. We'll try to accommodate anything that you need. Need a day off. We're not. As long as we get to make up the required days. If you need to, we've had happens. Things happen. Students have had illnesses or family emergencies. Our residents they get along with the students. They're always enthusiastic. They like the students. They like teaching. I think anyone will be coming here, they have a good experience. I'll let Jalicia talk more about the accommodations. Yeah, and the hospital accommodations as well. Jalicia.
Okay. Hi, I am Jalecia Lewis. Sorry, kids, I should have told you to update on that on the slideshow. But Jalecia Lewis, and I am the student coordinator here at Southwest Texarkana. And just a little bit about your experience and what it'll be here. You'll have a custom schedule. You're typically in clinic Tuesday through Thursday, having Fridays and Mondays off, just simply because I think sometimes students would like to travel back home. We had one student last year whose wife was pregnant, and it kind of benefited him to be able to go back and check on her because she was late in her pregnancy. And so we try to keep it like that unless otherwise something's conflicting with the schedule to allow you to have that Friday and Monday off, then that's what your schedule will typically be. We do have ground rounds every other Wednesday, and food is provided at those. Didactics every Thursday, no food provided, so make sure you get your lunch. You are able to eat free at the hospital. At any time, you have the option of doing the main line in the cafeteria, or you also can go into the physician's lounge, and the food is really great in both locations. Just a little bit about the housing: 2 bed, 2 bath. It's kind of centered around a busy area where you're close to Walmart, Target, a lot of shopping areas, a lot of food areas. It is not a part of a complex, so there's not like a gym or anything like that. But if you're into the hiking and the walking, we have a lot of those different areas throughout town. You will be able to work with behavior health and also Form D. You will not be at the hospital. You'll be clinic-based only. We do have an open door policy at any time. My job and hope for you is to allow your experience here to be great. At any time you have any questions, concerns, anything like that, I'm here at your disposal. You can reach out to me anytime. Dr. Diaz, a lot of our faculty and residents, like I said, we all have an open door policy. Don't ever be afraid to ask any questions. If you're confused about anything, we're just here to make sure your experience is great. As far as the housing location and distance, you're only about 5 minutes away from the hospital and less than 10 minutes away from the clinic. But like Dr. Diaz said, this is a unique area. We're right next to Texas, close to Louisiana. We're right up the road from Little Rock and Dallas. So just whatever you need, we're revitalizing the area downtown. There's a lot of different things to do. You just have to make that conscious effort to get out and explore the town if you want to. I do have Sarah Oninger and Andrea Carter on. Sarah completed her M3 earlier in the year, and so I wanted her to speak first because then Andrea, she just recently finished hers about a rotation ago, and so it was a little different for Sarah because we had just started the new academic year. So that year was busy because we don't really we have residents who are not available because they're doing something else. And so it's just a little different. So I just kind of wanted their experience to be shared from both ends. So Sarah, if you can go first for me, please.
Yes, ma'am. Can y'all hear me okay?
Yes.
Okay, awesome. So I'm Sarah.
Yeah.
I'm a third year. And like Jalecia just mentioned, I had my rotation in the summer. First of all, I would like to commend Jalecia on being so welcoming. The first thing we did was hopping in our cars and we all took a tour of Texarkana, took pictures on the state line and downtown, and it was super fun. I never felt like I couldn't ask anyone at the clinic any specific questions I had. Everything felt very no judgment. Like it's a clinic where you can kind of take your own pace, which I really, really appreciated. I feel like, especially depending on where you're at in the year, you may be comfortable with some things and not. So that everyone always gave you the opportunity to do everything you wanted to do with no judgment. So I got to burn off warts and I got to do pap smears and injections and a bunch of cool stuff. And as was mentioned before, you kind of get to take some leeway on if you're comfortable going in the room and doing interviews and things like that. So it was really great. Like as already mentioned, the schedule is really awesome. They're really good about giving you half days to study and didactics. We have on Thursdays where they provide snacks sometimes and we play Kahoot and we have a good time. We get to leave a little bit early those days too, which is really helpful. We have a wide variety of patients. So I got to see everything from a week old to 97 years old and everything in between. And it was very, very interesting. And I came out of the rotation feeling very well prepared for our shelf. As some of y'all, I'm sure, have heard, the family medicine shelf is very hard, and it's definitely something you want to take your time to be prepared for because it's anything that could ever happen. So I felt very well prepared. The residents and attendings were all so kind. And the way our schedule worked, we were one-on-one with each person we were assigned to that day. So it was really good for maintaining relationships and gaining trust and being able to kind of explore all that you can do as a future resident and attending. So I really, really loved it. Making sure I didn't miss anything. Oh, the food is very good in the cafeteria, especially in the physician's lounge. Very good. There would be ribs and barbecue chicken and desserts every day. Sorry, I'm at Arkansas Children's. But yeah, really great. I really, really, really loved it. I got to do ultrasounds as well. And I think that might have been it, other than what's already mentioned. But yeah, truly great environment. Loved everyone. Everyone was so kind, and you really did get to work at your own pace and push yourself as you were comfortable with, which I really appreciated. So yeah.
Thank you, Sarah, so much. Thank you, thank you, thank you. Andrea?
I don't want to repeat a lot of what Sarah said. It sounds like we didn't have that different of an experience there. But Texarkana was great. You do get to meet, it's been mentioned several times, a bunch of different patients from a bunch of different populations. The population there is a little bit different than Little Rock or even Northwest Arkansas. So if you've never been outside of those areas, it's a good experience to go down there and just experience what some of the Southern Arkansans experience and how they live. Um, you get to work with a bunch of different providers and residents. They are all super approachable, all very nice people. They all love to teach. They're very helpful with patient encounters and your learning and asking questions afterwards. And they're just very nice people. Jalicia is great. She's always available whenever you need her. If you ever have questions, don't ever hesitate to reach out to her when you're there. She does great about checking in with you. Family medicine has quite, I wouldn't say a lot of extra things to do, but they want to make sure, like Sarah was alluding to, that you're prepared for your shelf. So Jalicia is on top of like making sure that you have all your things done so that you get your grade at the end and all of that good stuff. I loved the half days for studying. I was one that traveled back to Little Rock, so I was only in Texarkana Tuesday through Thursday, which was great because a lot of my other classmates didn't get to experience that. And then I liked where the housing was located because, like they said, it's close to the hospital. It's like right in the middle of Texarkana where all the food and all the things to do in Texarkana are, other than like if you want to go downtown or something like that. But it's not that big where, it's hard to get around. I loved it. I had a great time. You should definitely go or consider going. And yeah.
Thank you, Andrea and Sarah.
All right, Fort Smith.
Hello, I'm Ruby. I'm the site coordinator for Fort Smith. And then for our student, we have Elena. I'll talk about some of the things here at Fort Smith. We're a quiet and quaint little town. I would say we're big, but also feel kind of small, if that makes sense. But our clinic, we have 26 residents, about 8 faculty that we have here. We also hold 1 to 2 days of ultrasound clinic and 1 day of procedure clinic, and this is every week as available. You'll usually be paired up with Dr. Clardy, our site director. Unfortunately, he could not make it to this meeting, but I'm covering everything I think I can for him. Primarily, we'll have you with the faculty and senior residents, and usually that's about 50-50 with each, or sometimes 75 to 25. You also get free meals here at Baptist Health. Our clinic is just down the street from Baptist Health, so it's just a walk away. It's easy. You get free meals from the physician's floor, which is supposed to be better than the cafeteria food for everybody else. And then they also have a coffee shop, a gift shop, and you also get free access to their gym. Their gym is called Marvin Altman Center, and they also have a pool there. So if you're interested in gym activities and pool, you can have access to that. As for housing is about an 7 to 8 minute drive. Um, it's a 2 bed, 2 bath. It's pretty furnished, well furnished, I would say. And then in the area, it's a pretty good, quiet area. It's actually near Creekmore Park and like the main library here in Fort Smith. And it's close to Walmart neighborhood. There's also a coffee shop nearby. So it's around pretty accessible things. And it's also near the mall as well. And then for didactics, we do hold didactics every Wednesday. It is about a 4 hour long session or so with some breaks in between. It's usually about 1 to 5, and or if we have grand rounds, it'll be until 4 o'clock. So, and then there's plenty of restaurants here to choose from as well. I feel like we have a variety of Asian, Mexican, American, South, no, Mediterranean. That's what I was thinking of. But yeah, I think that's it. And then I will let Elena talk about her experience here.
Hi, I'm Elena. I went to the Fort Smith campus in October. I had a great time. I'm originally from Fort Smith, so it's kind of easy for me to make the decision. They do give half days. So I think Monday and Friday when we had lecture, we get the rest of the day off. And then on Wednesday, we had lecture in the afternoon. And lectures were pretty good in Fort Smith. There was mostly like ultrasound and how to do ultrasounds. So we got hands-on experience, like doing knee ultrasounds, I think was one day. They also have procedures in clinic, which I thought was really cool. I want to do surgery, so I liked watching them do it in clinic. I didn't realize how much they could do. They do a lot of OB/GYN procedures. They have a really good fellowship for that. They do family med and OB/GYN there. Dr. Cardy's great with that. He really cares about you learning. If you ask to do something, he's very accommodating. If you want to do more ultrasound, he'll have you do it. They let me go to a conference during my time. So, and I don't think I had to make up days for it, which was great. I missed like a few days and it was really easy to get back into everything. Like they said, you get free food, it's pretty good. The housing's great. It's right by a coffee shop and library. Overall, all the residents were super nice. Dr. Stinnett was amazing. He taught me a lot. He taught me how to study for the shelf, which was important. And other than that, it was pretty great. I mean, I really liked it. And Ruby's super nice. She's really great.
Awesome. Okay, so looking at the time, we've got about 10 minutes left. And then we're going to hear from 2 more sites. So I want to make sure that we do get a chance to get to everyone. So let's go ahead and hear from Pine Bluff.
Hi, I'm Cynthia. I'm the student coordinator down here in Pine Bluff. Here at our site, we have two apartments. They are both 2 bedrooms. They're within walking distance of the hospital. While here, I will give you a schedule. On your schedule, you'll work in the clinic 3 days, and one day you'll have Friday will be your study day. I will allow you to go to the emergency room. You go to the emergency room at least once a week while you're rotating through here. Also, we have a wellness center that JRMC has. And if you would like to go to the wellness center, they will allow you to go in the wellness center for no charge at all. Some things that you can do here, we recently opened the Magnolia. It's located downtown. They have about 3 or 4 restaurants down there. You could sit outside. They have like a little balcony. You could sit outside, but of course, now it's too cold for you to go out there. But it's really nice. We also have a railroad museum. We also have an aquatic center that you can visit as well. And I think that's about all to cut down on time. And I have Dr. Finley here. He's going to tell you a little bit about our program.
Well, we've clinic that's right across from the hospital, and most of the time in our clinic, you'll spend with one of the second or third year residents that are in the professional building across the street. That will be up to 3 residents per side on 2 different clinics that are immediately adjacent to each other. So gives you an opportunity to see there'd be enough work to do on both of those. There is a faculty clinic, and some students get to spend time there with two faculty persons on each side. We do have a variety of skills amongst our group. The long-term effect of the having been here for now over 50 years is really good to establish our place in the community. And she mentioned the ER. The ER is staffed by 90% of the ER attendings are graduates of our program. So we give you an idea about family doctors working as ER physicians in needy parts of Arkansas. We do have, I believe we have Mackenzie.
Yeah. Can y'all hear me?
Yes.
Okay. I'm Mackenzie. Loved Pine Bluff. I'm planning on trying to go there actually for my 4th year for my AI. So definitely love that place. I feel like it's one of the rotations that people do not hype up enough. Miss Turner, she's so accessible. She's literally on the 2nd floor of the clinic. So you can always, if you have any problems, you can walk up there and see her and get any questions answered or anything like that. I ended up doing the housing down there and it was super nice. Had everything you could need besides food, had everything in the kitchen you could need, was completely furnished and was, I thought, very, very nice. And besides that, if you don't want to drive, it's like a 40-minute all interstate drive to get to Pine Bluff. So you can feasibly stay in Little Rock if you want to. Um, Also, the housing's walking distance from the campus, so that was nice. In clinic, you're fed every day at lunch. They bring food over from JRMC, and it was really, really good. Like sometimes I would actually take me a little to-go box home if I didn't feel like cooking that night and there was leftovers. Also in clinic, um, you get Monday afternoons off and Friday afternoons off for like studying after you have morning lectures for regular didactics. So that was really, really nice. I felt really prepared for the shelf whenever it came around. Um, so clinic, they have a really, really like family dynamic environment there. Like everybody jokes and everybody seems like they're friends and that they get along really well. And I really felt like they kind of pulled me in and I felt very welcome the entire time I was there. You get pretty much autonomy there as you want. Like if you feel comfortable with stuff and procedures and seeing patients on your own and physical exam, they're like, yeah, go do it. If you don't feel comfortable, then they'll walk you through stuff and then maybe the next time you do it on your own. but they're really good about checking in with you, both residents and attendings, checking in with you, making sure that like you're comfortable and you're getting out of the rotation what you need to get out of it. And also the population there is like super diverse pathology wise. Like you see a lot of things. Like y'all don't know this yet, but y'all have to fill out a checklist and see certain things while y'all in rotations. I think that I filled mine out the first week just by the patient volume and how many different types of people that you see come through that clinic. Um, I had a lot of procedure opportunities. I did like ear impaction treatment where they wash out the ear, skin tag removal, pelvic exams with pap smears, and that was just in the clinic. And then, especially if you're interested in emergency medicine, you get to go over to JRMC and kind of see how an emergency room runs that's not UAMS, that's mostly like attending driven. And they're all super nice and let you get as hands-on if you want as you want to there as well. And they kind of get a lot of crazy stuff that comes through that ER. Like there was one shift, I think we ran like three central lines, did a shoulder dislocation reduction, ran a code, and did like intubation with that. And that was just one shift there. And everybody that is at Pine Bluff are just really, really good teachers. And I learned a lot there and felt super comfortable going into like further rotations and stuff. I think that's all I have.
Thank you.
Thank y'all. Okay, we've got CrossFit showcasing them. This will be something new. And so we do want you guys to, on the survey, go ahead and rank. But there are select months that will send one student over to CrossFit. So just be mindful of that. But yeah, let's go ahead and hear from CrossFit.
Hello, my name is Jackie Clark. I am one of the newest faculty here at CrossFit and the site director for student education. I am also a little new to CrossFit, but I think that also puts me in a good environment to tell you all about it. So here in CrossFit, we just started a residency program. We actually have our first class of residents on the ground here in CrossFit now. They spend their first year down at UAMS, or up in UAMS because it's north. So we're in Southeast Arkansas. We're very close to Felsenthal National Park. We're a pretty small town, about 5,000 people. We have a local hospital, Ashley County Medical Center. That's a critical access hospital. Primarily, we have our students experiencing the outpatient clinic, either with an attending or one of the residents. We usually go by half days to get kind of a wide breadth of practicing experience. Usually, when you're rotating with a resident, we'll have you go in, see the patient, get the history, do the exam, present to the resident, and then also the attending as well, like a team. We have didactics every day at noon, and food is provided to you at the hospital. Well, we bring food over from the hospital to here. We have a little conference room that we do our didactics on. And we do also try to get you some experience in our ER as well as inpatient. We'll have days where you spend over in the hospital, probably with a resident, but if we don't have a resident in the hospital or in the ER, then with one of our attendings there. And so I also do a more traditional family practice. So I see patients both in the clinic as well as in the hospital. So students who were interested in seeing that can also see how that looks like. Rounding with me in the morning before clinic to go see patients in the hospital, and then moving to the clinic to see patients. Our didactics range pretty widely throughout the day or through the month. We try to hit on, your common practices, try to make sure that everybody's up to date. We have a couple of restaurants in town. Coffee shop's really good. The bistro's really, really good. And especially if you like nature, there's lots to do around here. It's very pretty. We have Felsenthal not too far. Lucas Pond is here in town. And then we also do have lodging. We usually use the hotel across the street, which from the clinic, so it's literally right across the street. And I think there are some B&Bs that we've also used. I'm going to let Christy talk about that, though, if she's still on here.
Yes, welcome. We're so excited to have your medical students in CrossFit. And actually, Dr. Clark didn't mention she was formerly a third-year medical student with CrossFit with NYIT, not UAMS, but she knows exactly what it was like to be an M3. Then she did some M4 rotations, and then now she's back as faculty. So we think we're pretty good at helping our students find what it is that they want to do with family medicine. Of lodging, we are still working out the details with the lodging since we're so new to this. And when we actually get our students for those months, we will for sure be working that out in the next few months. But we do have several different options that are available to us that we'll be working through. The other thing I wanted to mention, we do have a dedicated wound clinic that our students get to rotate through, which is a little bit different than a lot of the other facilities. And then we also do have free gym membership as well at a local wellness center. So that's available to all the students as well.
Oh, and something I did think about. Sorry. This is our first time doing this, guys. My apologies. Somebody had talked about procedures beforehand. Being a rural health clinic, we deal with whatever walks in through the door. So if you're interested in that kind of more procedure heavy clinic, we do a lot of those. Your basic women's health, pap smears, if it comes in, we take care of it. We also do a lot of derm procedures. So we do biopsies, shave, punch, whatever the situation, laceration repairs. I've had somebody come in within 15 minutes of trying to cut his finger off with a bandsaw, and we were able to take care of it here in clinic. Same with abscesses, INDs, you're kind of a lot of procedures here in clinic. And we always try to grab, a student, even if you're not necessarily like working with me that day, if you're working with Dr. Ben or Dr. Brad, we do try to go and grab y'all so y'all can experience those procedures as they walk in.
All right. Well, thanks everyone for participating. I know we went a little over time, so if you do have to run, go ahead. I'll just briefly close it out with, I will send a follow-up email. Since this was recorded, it will be posted on our website. But guys, if you have any questions or need to get in touch with anyone from our sites, just shoot me an email and I'll get you guys connected so we can get those questions answered. All right, see you later. Bye.